Hello everyone. All of us, or at least one member of our families, have a disability. Maybe in some organ or in any part of the body. This disability may be caused by birth defect or as the result of chronic incurable diseases or an accident or even by aging. These disabilities lead the person and these disabilities may lead the person to suffer from many problems such as pain in joints which make the person difficult to move, or it can causes loss of the hair, or it can causes many skin abnormalities and many other problems that can affect the person's life and make it more harder. And the current or conventional treatment just focuses on treating or reducing the symptom of the disease or disability, but it can't fix or renew the organ state. So today I will talk about the ability of fixing or renewing the exhausted tissues and organs and come back to the original state. I am Mina Emad and my seminar is about regenerative medicine and tissue engineering. And this is a table of contents. At the first, I want to introduce the phenomenon of regeneration and also to explain why we need the regenerative medicine. This is a salamander, very special animal as they have an excellent regenerative potential. The salamander, if it loses his limbs for any reason, it has the ability to regenerate new limbs. And it also has the ability to do this process with any part of the body and with many organs of its body if it loses it. But unfortunately, the human can't do this. If we lose a leg, regardless of how long we wait, we won't get another one. Although that the human have regeneration potential, but regenerative in human take place in some capacity throughout life. For example, skin and blood are continually restored, while liver and bone and muscle have limited capacity for self-repair. This happen in normal throughout life. But what if a traumatic injury or extensive damage is occurred? While the regenerative power of adult tissue isn't sufficient to cope with this damage. Here we need the regenerative medicine. Regenerative medicine is the treatment of medical conditions that harness the human body's inherent ability to regenerate tissue at level of cellular and organ structure, that fosters cellular communication and translation and organ system refurbishment. And all these result in overall organism well-being. This concept and ability is formulated into several strategies and applications, such as tissue engineering, cell therapy, and gene therapy. At the first, tissue engineering. Tissue engineering is the using of specific cells and biocompatible material and suitable biochemical and physical factor aiming to construct tissue-like structure that able functionally replaces the original structure. Therapy is the using of autologous or allogeneic progenitors of adult or embryo stem cells intending to mobilize these stem cells residing in the host themselves and stimulating their proliferation and differentiation. Gene therapy. Gene therapy is the intentional delivery of genetic material to a patient, aiming to correct a specific genetic defect with phenotypic consequences by inserting into abnormal cells normal genes, which would be able to take on the function that the faulty genes were not performing, or to give the patient cells new properties. All these strategies need specific materials and providing a specific environment, and the most important factor is specific cells. For example, in tissue engineering, we have to provide cells and scaffold and suitable environment. Stem cells. Stem cells is cells that able to proliferate and differentiate and become specialized cells with a more specific function. And there are different types of stem cells that differs in their capacity of proliferate and differentiate according to their sources. These types are embryonic stem cells, adult stem cells, induced pluripotent stem cells, and perinatal stem cells. And the second important factor of tissue engineering is scaffolding technologies, biomaterial and scaffolding technologies. Scaffolds are designed to provide a three-dimensional environment to support and direct cellular processes in their migration and proliferation and differentiation toward a functional tissue. Scaffolds must be biocompatible with the host tissue and porous enough to allow nutrients to reach cells, and ultimately degraded without any toxic effect during tissue development. The third important factor is suitable environment. This environment contains specific chemicals and growth factors and bioactive molecules, and this environment work on replicate the biological and the mechanical function of the native extracellular matrix that found in tissue in the body by serving as an artificial extracellular matrix. Addition to these important factors and materials, there are technologies that enable us to apply the regenerative medicine and tissue engineering. These technologies such as 3D printing, genome editing, cell sheet technology. At the end of my seminar, I want to talk about an application of regenerative medicine. Diabetes is one of the most chronic metabolic diseases that characterized by high level of glucose in the blood, which can be divided into two etiopathogenic categories: type 1 diabetes mellitus and type 2 diabetes mellitus. The treatment for patients with type 1 diabetes mellitus is immunosuppressant agents, which don't repair the beta function, the function of beta cells. The current treatment for hyperglycemia that caused by type 2 diabetes mellitus is to supplement the patient with insulin, which only gives limited control over the patient's blood sugar level. But now, by using a regenerative medicine concept, the use of stem cells in treating diabetes give new hope to the patients for diabetes mellitus. And there are numerous studies have been performed on animals using various types of stem cells, especially mesenchymal stem cells. And there are also animal models that have shown the stem cells transplantation is safe and effective. In conclusion, regenerative medicine is the future of medicine, as it will be able to achieve what is the conventional medicine can't achieve. and may lead to extend the rate of ages and may overcome the aging and incurable diseases and birth defects. And at the end of my seminar, I have to thank all my doctors and especially my supervisors, Dr. Nashat Nabil and Dr. Angie Mukhtar.